Well, thank you, Mr. Chair and Ranking Member Moran, and thank you, Secretary Mcdonough, and all of our other witnesses for testifying today. And Mr. Secretary, I wasn't on the committee yet when you were confirmed, so this is my first hearing where you're appearing. I'm really looking forward to working with you to help veterans across the country and in New Hampshire get the benefits they earned and deserve. New Hampshire is one of 3 states, along with Alaska and Hawaii, that lacks a full-service VA hospital, something I'm working to change. As my colleagues have pointed out, the VA's budget is insufficient to meet the agency's dire infrastructure needs. In your prepared testimony, you noted that the President's proposed funding in the American Jobs Plan for VA infrastructure, and that's something I strongly support as well. But we need to make sure that any VA funding that goes toward infrastructure adequately addresses the need of Granite State veterans. So does the agency take into account the lack of full-service VA hospitals in certain states when developing your budget plan and priorities?
We do.
Well, that is helpful to know, and I'd love to continue to work with you to make sure that, especially as we deal with the needs for community care and improved infrastructure at the resources we do have in New Hampshire, that they are attended to.
Count on that.
Thank you. The National Cemetery Administration has made increased access to burial benefits a strategic goal. This includes providing additional grant funding to state and tribal organizations. Unfortunately, as a condition of receiving VA money for improvements, state veteran cemeteries are barred from interring many National Guard members and reservists. Today, I joined Senators Shaheen, Kramer, and Hoeven in introducing a bipartisan, bicameral bill that addresses this issue. So, Secretary, will you and your team consider this bill and provide us with feedback? And will you work with my office to increase access to burial benefits, including for National Guard members and reservists? It's a matter just really incredibly important to Granite State veterans.
Yeah, I'll say 3 things about this. I don't want to eat up your time, but one is the budget request in the President's budget for this year continues a strategic expansion of our cemetery footprint to ensure that everybody has access.
Right.
I'm very proud of that service. I think this is really important investment. Yeah. Second is, it came to my attention very early in my tenure here that we have a discrepancy whereby New Hampshire has asked for one way to use its state grant from us for its cemetery. It's inconsistent with current reg.
Right.
But there is North Dakota who's currently using VA-provided funding in that same way. Okay. We've gone out with a request for information to the field, to all 50 states, to say, hey, how should we do this?
Okay.
And then we'll have a conversation with you about it. And in all cases, I'll look at your bill.
Well, I appreciate that very much, and I know Granite State veterans would too. Last question. In this year's budget, the Veterans Benefits Administration lists 2 organizational priorities: benefits delivery and suicide prevention. The veteran suicide rate is highest among those 18 to 34 years old. This age group also accounts for 75% of transitioning service members. You and I have discussed the Solid Start program, an initiative that aims to contact every veteran multiple times by phone in the first year after they leave active duty to check in and help connect them to VA programs and benefits. I have a bipartisan bill with Senators Kramer and Cassidy to strengthen and make permanent this important program, which the committee will consider further, I hope, during our legislative hearing next week. Secretary Mcdonough, can you please speak to how the Solid Start program aligns with the Veterans Benefits Administration's priorities, and will you work with us to support and build on this program?
So often the benefits package is the introduction to VA services for our vets. Yeah. And we want to make sure that that introduction is not only professional, transparent, based on the customer service and a positive experience, but that it also opens the door to the full range of services we have. So being in touch with our vets, including about introducing them to all of our services, including when necessary mental health services, is really important, and it's consistent with what we're doing through our program called Reach Vet, which is a fundamental tenet of our suicide prevention programming.
Yeah. Well, thank you. I'd love to continue to work on this and the Solid Start program with you. What I'm hearing from veterans is just there's so much transition going on in that first period after they leave active service that they could really use that kind of steady outreach, and it may take multiple attempts. And I think it really benefits all our veterans and the country. So
Might
thank
be a good
you.
way for us to get more enrollees too.
Yeah, yeah. Thank you. Thank you, Mr. Chair.
Senator Bozeman.